Welcome to the What Doesn't Kill Me podcast, a podcast for those with chronic illness, chronic pain, and for those that love and support us. I'm Meg Quinlist, your host. After 45 years of living with debilitating rheumatoid arthritis and having had over 45 surgeries, I have learned a thing or two. Chronic pain can be a lonely existence. It can leave us feeling alienated and disconnected from others. So just know that this is a safe space. We are going to share our wisdom and our woes. We're going to offer support and advice so that we thrive. Hi, everyone. Today's podcast guest is Marla Ririe. This story is amazing. Marla is going to tell us her journey on how she went from a state of physical and mental brokenness to a state of wholeness. Marla has several chronic pain conditions. Her first one is Ehlers Danlos. Now, Ehlers Danlos is a connective tissue disorder. Her body doesn't make enough collagen. So her joints are hyper flexible, hypermobile, and it leads to joint instability and joint pain. These are the type of people that can bend their thumb way back to touch their hand, can do all kinds of crazy things with their joints that you look at and you think, man, they're really flexible. Well, it's much more than just flexibility. It leads to a lot of joint instability and a lot of chronic pain. It causes pain in most of her joints. It causes pain in her lower back, her hips, her SI joints, her knees, her neck, and her ankles. It's so bad that at times she needs braces for that extra support. And when it really gets bad, sadly, Marla also needs a walker. Ehlers Danlos has a lot of other symptoms associated with it. One of them is migraines, which is something that Marla gets. In her 20s, her migraines lasted for anywhere from 10 to 15 days, which was terrible. But as she got older, it got worse. They lasted anywhere from 30 to 120 days. Lately, Marla's had migraines and they've only lasted 5 days, which to Marla is awesome. Another one of these comorbidities is POTS. It's a situation where you have a very high resting heart rate. Her heart rate could be 80 at rest, and then when she does any kind of movements where she sits up from a resting position, if she's laying down and then sits up, her heart rate increases, causing her to get dizzy, to black out, and faint. She also has mast cell activation syndrome. She has these crazy allergic reactions to different things, from things she eats to things she touches, so severe that she can get anaphylaxis, where she can't breathe and her throat closes up. In addition to all of that, she also has psoriatic arthritis, which is pain and stiffness in the hands and the back. She also has Achilles tendonitis and plantar fasciitis. Imagine all that pain. Imagine what her life was like before she finally decided, no more. I will no longer live like this, being in constant pain and complete brokenness. She was able to go from a daily pain of anywhere from an 8 to a 10, which is huge and really high, down to a 1 or a 2. Marla is going to share with us some of those small lifestyle changes she did and some of the really big and difficult lifestyle changes that she made to go from a body that was broken to a body that was whole. She was able to heal her mind, her spirit, and her health. My interview with Marla will be shared on this podcast in 3 20-minute episodes. Her story is filled with so much information and so much good stuff to digest that I realized that anything more than 20 minutes is almost too much and it can be overwhelming. So I decided to separate this into 3 smaller sections. So give us 20 minutes. Hopefully we'll give you some new insight and some great information, and we'll also give you some hope. Marla, it's so nice to meet you, and I'm so glad that we connected through Facebook. If you could tell me a little bit, I know you said you had 2 different types of arthritis. Can you tell me what types of arthritis you have?
Yeah, so I have a genetic condition called Hypermobile Ehlers Danlos.
Oh, wow, I never even heard that.
Oh,
yeah.
You'll probably end up knowing a lot of people who have it. I think it's frequently misdiagnosed, undiagnosed. I'm 51. I didn't get my diagnosis until I was 46.
Oh, wow.
40,
okay.
45, 46, somewhere around there. So I'm hypermobile.
Oh, wow. Jeez. Yeah.
My God. Will go back both ways. Wow. So one of the ways to test is if you put your hand at it's 1 point on the test. And if you can put your pinky to 90 degrees, you get a point. Mine will go back.
Holy gosh.
Sides. So you get a point for each arm. So it's a test called the Baton score, the Baton
Okay.
test, and it tests the hypermobility of certain joints in your body, your elbows, knees, hips. No, not, yeah. Forward fold down, lay your hands flat on the floor. Even when my hamstrings and lower back hurt so bad, I can still bend over and plop my hands down on the floor.
Wow.
So I had symptoms of that my whole life, but what it causes is if you just take your finger, this is the normal movement, but ours do all kinds of, you get the little
Yeah.
bend, the thumb.
Right.
Ours do a wider range of motion, so it causes overuse arthritis.
Oh.
It's a genetic condition. Our bodies don't produce enough collagen, so we have really loose and lax ligaments and tendons because they don't have enough collagen in them. So our
Yeah.
muscles have to do more work as we age. Our muscles just get tighter and tighter, trying to hold our joints into place. So it causes a body pain.
Yeah.
The fun things that come with it. Everybody's different. It's so wild because you'll talk to somebody and they're like, oh no, I don't have migraines. I have migraines. My daughter has migraines. My son's only had about 2. He's 23, 24. Mine didn't start until I was in my 20s.
Can I ask you, do they have this? I'm sorry to interrupt, but they have the same situation? So it's
They do.
very, like you said, it's genetic and it's very much, it
It's
doesn't sound like
genetic,
it
yeah.
skips a generation. It sounds like it's very,
All 3 of my kids have it.
wow.
Yeah, to varying degrees. My oldest he's got the knees and certain pains. I think he probably has the least amount of symptoms, but it's hard because he doesn't talk about his symptoms.
I can understand that. Yes.
And my daughter and my youngest, I think my youngest actually has it to the most. He's the only one that has the stretch marks, which are common. But yeah, he's had those since he was 6th grade, 7th grade. We attributed it to growing pains until we learned more about our condition. But yeah, he's got stretch marks down his back.
Oh, great.
So my daughter and I are the only 2 that have in our little family, but the only 2 that have severe migraines.
Okay.
And crazy migraines. And the migraine is how I ended up figuring out my own diagnosis and then took it to my doctors.
I find that happens so often. It really does.
I see it a lot on the Facebook groups.
I do too.
I think I'm hypermobile. I think I have this. Where do I go? Who do I go for diagnosis? And so I actually took it to my doctor. I babysat when I was a teenager. I babysat a friend's daughter. And then when she grew up, she babysat my kids.
Oh, nice.
She was the only other person I ever knew that had my kind of migraines.
And describe when you say my kind of migraines, do they cause blindness? Do they cause just severe pain?
Severe pain. I'm really big on communication.
Yeah.
With your pain, communicating to your partner. And my husband rarely gets headaches and he's never had a migraine and couldn't understand what my migraines felt like.
Yeah.
So on my good migraine days, I'll tell him, imagine the worst headache you've had. And that's what I'm feeling right now. On my bad migraine days, I said, it feels like somebody drilled a hole into my head and poured acid over my frontal lobe.
Holy God.
Because it's usually this right here, but it literally feels like my brain is on fire. But my migraines will last. Now, right now they're better, but in their heyday, my migraines would last anywhere from 30 to 100 and something days, 170 days long.
You're kidding me.
No. Yeah.
You'd be living in this pain for 30 to 170 days.
Yes. Yeah.
You have blown my mind. How did you function? Like, how did you?
And I get that question a lot and I don't know.
Yeah.
Because I've had people, the funniest one I had was somebody at church. And I'm like, I'm on like day 30 of this migraine. And I you just get used to it, right?
That's true.
You get used to your pain.
You do. Yeah.
So I would get used to them. So a 30-day migraine, that's when it would start to get annoying for me. It's when my brain would slow down. I start really stumbling over my words. 60 days where we would typically try and go on a steroid dose pack to try and break the migraine. That 160-day migraine was probably the worst I've ever had. And the steroids wouldn't break it.
No.
But I had somebody at church one day say, oh, yours must not be as bad as mine because when I get a migraine, I just have to crawl in bed and I have to sleep it off.
Don't you love that? Yeah.
Bills don't pay themselves, honey. I got
Yeah.
a job. I have
Yeah.
to work.
Yeah.
I don't have a choice. I can't lay in bed for 30 days.
No.
So, and
Yeah.
now my migraines are down. They're more controlled. So the one I have now started 3 days ago. So it's not bad. It's there. It's in the back of
Yeah.
my eyes constantly, but I don't like taking meds. So I
Yeah.
try eat protein and stay really well hydrated. My migraine will back off. I'm only taking something like Aleve maybe once a day.
Oh man. Have you tried other migraine medicines, or you're just like, I'm not, I'd rather deal with this? I'm sure I know, stupid question.
No, you're good.
Yeah. Yeah.
When you're talking about the different stages of healing,
Yes. Yeah.
when I was in the thick of mine, like before I had started my healing process, I was in the thick of my pain.
Yeah.
I used to have this saying that I swear if one more person tells me to try lavender oil, I'm going to throat punch them.
Yeah. Yeah. No, I get it.
Because I'm like, I have been on every med and drug
And it didn't work.
the sun. And yeah, the problem with autoimmune and with genetic conditions is your body adapts to it.
Very true.
And so I would go on a med and it would last for 6 months to a year and then it stops working.
Yes.
Or some of them I'm allergic to. It's also part of Ehlers Danlos so we have dysautonomia. My form of dysautonomia is my nervous system doesn't fire.
Oh, okay.
So we have what's called POT. I have what's called POTS. Not everybody does, but
I've heard
of
of
us
that.
do.
Yes, that one I've heard of.
Sitting down, resting, my heart rate's in the high 80s. Like my resting heart rate is probably low 80s. But if I'm sitting down just watching TV and I stand up, my heart rate jumps from 80 to 140, 150.
Wow.
And 25. It just depends on if I'm hydrated and what's going on that day.
Yeah.
Jogging the other day, my heart rate went from normally when I'm exercising, my heart rate's in the 120s, jumped up to 188. And I had to sit down and
Oh, that's scary. Yeah.
Deep breath work. And my service dog sits on my lap to lower my heart rate.
Yeah.
So we have POTS, we have migraines, and then MCAS. It's a mast cell activation syndrome is also quite common with. So when I have an allergy, I do it big, and it's typically anaphylaxis. So I have anaphylaxis to morphine, alcohol.
Oh my gosh.
So a bunch of the meds they've tried me on just flat out don't work, or they cause allergic reaction.
Wow.
Or I've done 5 or 6 when they came out with the new CGRP inhibitors.
Yeah.
For migraines, Vyepti. There's a couple of them. They worked and they worked great for about a year. And I've done Botox injections and physical therapy and yeah.
Yeah. Oh, wow.
So the thing that has helped the most is lifestyle changes.
Yeah. Yeah. So tell me about that. I'm so riveted by, because it seems to me that a lot of people try the medicine route and then, similar to what you're saying, they're allergic, it doesn't work. So they're left with no alternative. So it's either keep suffering the way you've been suffering or try something drastically different.
A lot of people don't want to try the drastically different.
Yeah.
And I've posed that question into the pain groups of, do you think nutrition has anything to do with our pain? And I have CRPS, that's chronic regional pain syndrome. It has nothing to do with what I eat.
Okay. Yeah.
It does.
It has absolutely everything we put in our bodies.
Eat, exactly.
Yeah.
Everything is related. And if you can decrease your overall inflammation level, your overall inflammation load, it's going to decrease your pain.
Yes.
But it's so controversial and
it's so sensitive. It's such a sensitive subject because there's so much guilt
really
involved in that as well. And I find even for myself, you get very defensive because you are
just like I did with lavender oil.
Yes, absolutely. You can't help but get defensive. And you also, until the pain of living the way you are becomes greater than the pain of changing, you really aren't going to do much about it, or you're not ready to do much about it. And some of that is just so ingrained in us, and I get it. And it makes it hard to help people because they're not open.
It does. It does. And that's okay. And hopefully they'll get there someday. And the ones that are ready are the ones that end up working with me.
Yes.
Or working with one like me.
Yes. Yeah.
So my healing started in addition to my Ehlers Danlos. In the middle of the pandemic, in the beginning of the pandemic, I got COVID from an ICU patient.
Oh, wow.
It was not supposed to be, they were supposed to be in the COVID unit. Doctor sent them to the wrong floor. The doctor didn't test them. Super early on, the first week in April of 2020, I got COVID. COVID triggered an autoimmune disease. So then I was diagnosed at the same time, I was diagnosed with hypermobile Ehlers Danlos and psoriatic arthritis.
Oh, man.
So mine was primarily in my hands, and it was all of my little joints. So my husband said I looked like a cat needing bread because I would wake up before I was awake. I would wake up stretching my hands because my hands were so stiff and painful.
Oh, wow.
I did that for several years. I did the methotrexate.
Yes, me too.
The injections. Now I'm trying to remember. I can't even remember what ones I was on. So the first one, the first biologic, but it was an injection. The first one they put me on, it helped. It like backed my pain off.
Yeah.
But it was still there. And so they stopped that one and put me on another one. And that one I had pretty good results with. By the end of 2022, I was so sick of being on all of these meds.
Yes.
Because I was still on methotrexate. I hated methotrexate.
I hated that one with the passion of 1,000 burning suns. I think that's the worst.
I did too. And my doctor did not understand it.
Yeah.
And I'm like, I feel, excuse my language, I feel like shit all the time.
Yes.
I'm so tired and exhausted.
And they love that drug. They love that drug.
They love it.
They love it.
And somebody who doesn't have chronic pain cannot understand how exhausting it is to slap a smile on your face and pretend you're okay and go to work for 8 hours, 12 hours.
12 hours. You are holistic RN. You're a holistic nurse, correct?
I am now.
Okay. But at that time you were...
I was an operating room nurse.
Oh, an operating room nurse. Okay. So you really had a physical, exhausting, stressful, everything type of job. You really did. Wow.
I did.
Yeah.
And that was emotionally one of the hardest things. Emotionally, that was one of the hardest things about my pain journey was letting go of the career. Yes. I went to nursing school to become an OR nurse.
Yeah.
Like, I didn't want to do any other type of nursing. I was a CNA in the OR before I went to nursing school to become an OR nurse.
Wow.
I loved surgery. I loved scrubbing. I loved being right up there, front and center at the table. And
you were probably so good at it too. From your passion, you can see.
Yeah. And I'm a type A, very organized.
You were a perfect fit for that job, except all the other things. Yeah.
Except for my body wouldn't do it. So when it got to the point, and at that point, I was on all the injections. I was on Botox injections. I was on quarterly infusions for my migraines, monthly injections for my migraines, monthly injections for my autoimmune, methotrexate. I would slap a smile on my face, go to work my butt off in pain. And by the time I got off of my shift, I would sit in my car and cry.
That was me too, with my job. I would cry the entire way home because I was in so much pain.
Yep. And then my husband would come out and get me out of the car because I could not get out of the car. I would sit and stiffen up.
Yeah. I know how you feel. I could cry because I know I had that same journey. I gave up my dream job.
Oh, it was hard.
Yeah. And gave it up so young. I gave it up and it was just the hardest.
It was super hard, super emotional in that. So at the same time, leading up to the time that I left the OR, we had a lot of death in our family. I quit the OR. I couldn't do it anymore.
Yeah. Oh my Lord.
I was mourning all of our losses. I was mourning my career. My stress was through the roof. So I had switched career paths, had switched jobs, and I started doing what's called PAT. So it's pre-op testing. So when you go in for surgery, and all of your health, and I do blood pressure and heart rate and go over all of your meds and tell you when to stop eating and drinking and where to be when. So that was my job. I did that for a year and discovered I really liked actually talking and getting to know my patients.
Oh, nice.
Because I didn't get that in the OR. That was the beginning of my healing journey, was discovering first okay, there are other types of nursing I can do that
are going to make
my
you
body
feel
can tolerate. And then I came across a podcast called Just Ingredients.
Oh, okay.
It's called Just Ingredients. And that's where I started learning about this non-toxic living, getting air purifiers, water filters, getting all glass, getting plastic and plastic food container, changing to stainless steel pots and pans, getting rid of perfumes and skincare that have all of these chemicals and estrogen receptors and blockers. So that was like the first kind of dive into holistic living. And I started with that, and I started slowly. When you run out of this cleaning,
switch product or thing.
Switch to the product. Yeah. When you run out of this skincare, switch to one that's better and doesn't have all of those hormone blockers in them. So I started slowly with that over that year that I was doing PAT. And then that's when I got to the point of, I don't want to do this anymore. I feel so gross with all of these meds.
Yeah.
My husband and I decided to quit our jobs and sell our house and buy an RV, which is where we are now.
Wow, that's so exciting. Yeah.
So we love it. So yeah, right at that time, I then sat down with my neurologist and my rheumatologist, and I said, I need a drug holiday.
I love the way you put that. Yeah. A drug holiday. Yeah. I love that. Yeah.
Drug holiday.
I need to detox.
I said, if we need to add things back in, we can add things back in. But I am sick to death of feeling like crap all the time. I'm tired. I'm exhausted. I can't keep slapping a smile. My body just won't do it anymore. My body, I ran through my reserves.
Yeah.
And my body didn't fake being well anymore.
God, yeah.
It was wearing me down. So with the help, and that's the one thing I always tell anybody and everybody who's going to listen, do not stop your medications without help of your doctor.
That's smart. Very smart. Yeah.
There are so many meds that will cause so many side effects if you don't taper, or you really do need that drug.
Yes, so, exactly. Yeah.
Do not stop without your doctor.
Yeah. Good advice.
Yeah. So I did. I got off all of my meds. I stopped my Botox. I stopped my Vyepti infusions. I stopped my monthly injections. I stopped the methotrexate, stopped everything.
Wow.
And that's when it got really bad.
Oh, okay. And that must have been so scary.
I ended up needing a walker. So I stopped like the first week of November. I was off of all of my drugs. By May, I was walking with a walker.
And was one of your first thoughts like, I have made a major mistake, like I need to go back on it? Or did you feel like I'm in it and I'm not giving up?
I'm in it and I'm not giving up.
Yep.
Yeah, it was, I just have to get through this. I knew it was my body getting rid of all of these
toxins.
Yes. I don't want to say poison, but so I needed to clear all of this out of my system, and my body needed to equilibrate again. I just needed to find a balance. That during that period of time is when I really discovered holistic, and I didn't feel like I had help doing that. I didn't know where to do or where to go.
It's like a black hole. There's so much out there and you're overwhelmed, and you try to do some research and you don't even know where to begin.
And that's, I think, where I thrive is I love research. So I did a ton of research. And one of the things I discovered with my migraines, nobody ever told me about, was that one of the things that is found in migraineurs, people who have chronic migraines, is that it's found that they are vitamin D deficient, which I have always been vitamin D deficient. So our livers produce thione. People who have chronic migraines are low on glutathione. One of the things a lot of people who have migraines take is acetaminophen or Tylenol. Tylenol decreases glutathione in our liver.
Wow.
So I'm stuck in this vicious cycle of I'm taking Tylenol because of my migraine pain, but I'm having migraine pain because the Tylenol is decreasing my glutathione.
It's a vicious cycle. Yeah.
So I stopped taking Tylenol. I don't take Tylenol ever. I started taking NAC, N-acetylcysteine, which helps your liver produce more glutathione. So I started doing these deep dives, and I started adding in everything I could think of to support my body during the detoxing and balancing out phase.
That's the end of part 1. for our first episode with Marla Ririe. Thank you so much, Marla, for sharing all that great information. I'd like to also thank our tech support team, Matt Strain and Frank Quinlisk. Artwork by Katie Quinlisk and music by The Narrows. We'll catch you next time for the second part of our interview with Marla, where she gives us much more specific information on what she did, from the things she tried to the things that worked and the things that didn't. She'll give us a lot more information. It's going to be really exciting, so join us.
Know that hereafter I'm setting out for good. Show that clear laughter, I'm betting that you would. Took time, shook mine, I fell flat on the floor. Look fine, hook, line, and sink a peaceful bloody war. Several times I made excuses for myself. Several lies are telling the boys I don't need help. Every time I find another door to crash right in, hopefully the light will shine when I